Psora as a miasm in homeopathy, principles and characteristics. In homeopathy, psora is one of the foundational miasms, representing a deep-seated predisposition to chronic disease. Introduced by Samuel Hahnemann, the founder of homeopathy, psora is considered the root cause of a wide range of physical and mental ailments. It is often referred to as the mother of all chronic diseases and is the first miasm that underlies human suffering, especially those that manifest as hypersensitivity, weakness, and chronic conditions. Principles of psora. 1. Miasmatic theory. Psora in homeopathic philosophy is not a disease but a dynamic disturbance of the vital force. This disturbance predisposes individuals to a variety of chronic illnesses that are often superficial but persistently troubling. The miasmatic theory suggests that unresolved infections or conditions like scabies create a lifelong vulnerability, leading to psora's influence on the body and mind. 2. Chronic predisposition. Psora is considered responsible for the chronic tendencies that manifest through different organ systems. It doesn't manifest as acute diseases, but predisposes the individual to long-lasting recurring issues, often involving the skin, digestion, respiration, and mental health. 3. Hypersensitivity. Individuals with psoric tendencies are often hypersensitive, emotionally, mentally, and physically. They are highly reactive to external stimuli, be it cold, noise, light, or stress. This sensitivity makes them prone to conditions such as eczema, allergies, asthma, and digestive disorders. 4. Mental and emotional characteristics. Anxiety. A major emotional trait in psora is anxiety, especially about health, future, and financial security. Insecurity and fear. Psoric individuals often feel inadequate or fearful of failure. They may exhibit a deep sense of inferiority, fearing criticism and poverty. Restlessness. Mental restlessness is common, with the mind constantly overworking, leading to intellectual exhaustion and mental strain. 5. Physical manifestations. Skin. Psora primarily affects the skin, causing conditions like itching, dryness, eczema, scaly eruptions, and rashes. Respiratory system. There is a susceptibility to chronic respiratory issues like asthma, recurring colds, or chronic cough. Digestive system. Psoric individuals often suffer from chronic digestive disturbances like bloating, flatulence, constipation, or indigestion. Weakness and exhaustion. A general feeling of weakness and fatigue, both physically and mentally, is typical. Psoric patients tire easily and may have low stamina. 6. Optimism despite illness. Despite their suffering, psoric individuals often maintain a sense of hope or optimism. They may experience despair over their chronic conditions, but still hold out hope for improvement, unlike other miasms like syphilis, which is characterized by a more destructive nature. 7. Affects the vital force. Hahnemann believed that psora disturbs the vital force, leading to functional disturbances rather than gross structural changes in the body. The body's defenses are weakened, making the individual prone to recurring, non-life-threatening but persistent disorders. Typical affectations in the body, mind, and emotions. Mind and emotions, persistent anxiety and insecurity, fear of failure, criticism, and poverty, intellectual overexertion and restlessness, optimistic but easily fatigued. Skin, dry, scaly, or itching skin conditions, eczema, psoriasis. Scratching leads to temporary relief followed by worsening of symptoms. Digestive system, tendency towards indigestion, bloating, and constipation, sensitive to rich, fatty foods. Respiratory system, recurrent colds and coughs, hypersensitive to weather changes, asthma and other chronic respiratory conditions. Joints and muscles, susceptibility to rheumatic or arthritic pains, often worse in cold weather. In conclusion, psora as a miasm in homeopathy represents a deeply ingrained vulnerability that leads to chronic health problems, emotional unrest, and hypersensitivity. Its influence is wide-ranging, manifesting in various forms of physical and mental ailments that persist over time, yet psoric individuals often retain a sense of hope and resilience amidst their suffering. Syphilis as a miasm in homeopathy, principles and characteristics. In homeopathy, syphilis is one of the 3 fundamental miasms introduced by Samuel Hahnemann. It represents the destructive and degenerative aspect of chronic disease tendencies. While psora is associated with functional disturbances and hypersensitivity, syphilis is linked to deeper destructive pathologies, where the body and mind tend toward disintegration and decay. The syphilitic miasm carries the theme of destruction and deformity, affecting not only the physical body but also the mind and emotions in a profound way. Principles of syphilis. 1. Miasmatic nature. Syphilis is considered a miasm of destruction, deterioration, and degeneration. Its essence is one of breakdown, physically, mentally, and emotionally. Hahnemann believed that untreated syphilis, or similarly destructive infections, leaves a miasmatic imprint on the vital force, leading to a predisposition to destructive chronic diseases. 2. Tendency toward destruction. Syphilitic miasm expresses itself through the tendency for destruction in all areas: tissue destruction, ulceration, bone deformities, and mental breakdown. Syphilis miasm often leads to gross pathology, severe infections, and degenerative diseases. 3. Mental and emotional characteristics. Despair and hopelessness. Individuals influenced by the syphilitic miasm often experience deep despair and a sense of hopelessness, feeling that their situation is beyond repair. Self-destructive thoughts. There may be tendencies towards self-destruction, including suicidal thoughts or behaviors. They may feel overwhelmed by guilt or a sense of worthlessness. Violent or aggressive tendencies. The syphilitic miasm may manifest through intense anger, aggression, or even violent tendencies. Destructive emotions and a lack of control over impulses can dominate. Paranoia and delusions. Mental degeneration can lead to paranoia, delusions, or obsessive thoughts, particularly involving themes of self-harm, persecution, or conspiracy. 4. Physical manifestations. Tissue destruction. Physically, the syphilitic miasm causes tissue destruction and deformity. This may manifest as ulcers, necrosis, bone deformities, and severe infections. Ulceration and suppuration. There is a tendency for ulcers, particularly in mucous membranes, with pus formation, leading to slow healing or non-healing wounds. Bone and joint deformities. The bones and joints are commonly affected, leading to deformities such as arthritis, curvature of the spine, or bone necrosis. Severe joint pain and stiffness are typical. Congenital deformities. Syphilitic miasm can result in congenital deformities, with children born with physical malformations or developmental abnormalities. Syphilitic skin eruptions. Skin issues may involve ulcers, lesions, and destructive eruptions that leave scars. 5. Chronic degenerative diseases. Syphilis is associated with degenerative conditions that progressively worsen over time, often affecting the central nervous system, bones, and circulatory system. Conditions such as multiple sclerosis, Parkinson's disease, and certain cardiovascular diseases are considered syphilitic in nature. 6. Absence of healing and destruction. Unlike Psora, where there is a tendency to improve with rest and care, syphilitic diseases often progress relentlessly. Even in situations where the body attempts to heal, the tissue may heal with scarring, or the condition worsens with time, leading to more severe degeneration. Typical affectations in the body, mind, and emotions. Mind and emotions. Profound despair, hopelessness, and thoughts of self-destruction. Violent impulses, aggressive tendencies, and irritability. Paranoia, delusions, and obsessive-compulsive behaviors. Guilt and shame often dominate emotional experiences. Suicidal tendencies or severe emotional breakdown. Bones and joints. Severe joint pain, arthritis, and inflammation of the joints. Bone deformities and curvatures, necrosis or deterioration. Chronic inflammation that may lead to joint stiffness and immobility. Skin. Ulcerations, deep sores or destructive lesions that heal poorly and often leave scars. Suppurative, pus-forming, eruptions or abscesses. Dark or discolored patches, often with a tendency toward necrosis. Cardiovascular system. A tendency toward cardiovascular diseases such as aneurysms or valvular heart disease. Weakening of blood vessels leading to rupture or hemorrhage. Congenital issues. Children born to parents with syphilitic miasm may show physical deformities, developmental delays, or chronic health issues from birth. Conditions like cleft palate, abnormal bone structure, or delayed mental development. Central nervous system. Neurological symptoms such as tremors, paralysis, or other progressive conditions like multiple sclerosis. Deterioration of mental faculties, including memory loss, confusion, and cognitive decline. Next summary. Syphilis as a miasm in homeopathy is marked by destruction, degeneration, and deformity on both physical and mental levels. It affects the body's tissues, bones, and mind, often leading to chronic degenerative diseases, ulceration, and mental breakdowns. Individuals affected by the syphilitic miasm tend to experience deep despair, hopelessness, and self-destructive tendencies. This miasm also represents the breakdown of structures, whether it is physical tissues or emotional stability, and is associated with severe, often irreversible conditions. Psychosis as a miasm in homeopathy, principles and characteristics. Psychosis is one of the three major miasms in homeopathy, alongside Psora and syphilis. Introduced by Samuel Hahnemann, psychosis represents the miasm of overgrowth, excess, and chronic inflammation. While Psora is linked to hypersensitivity and syphilis to destruction, psychosis is characterized by excessive proliferation, both physically and mentally. Psychosis is often associated with conditions of overgrowth and chronic inflammation, including warts, tumors, cysts, and thickening of tissues. Principles of psychosis. 1. Miasmatic nature. Psychosis originates from suppressed gonorrheal infections, which Hahnemann believed left an imprint on the vital force. This miasmatic tendency leads to excessive growth and chronic inflammatory conditions, resulting in a variety of ailments marked by overproduction and stagnation. 2. Excess and overgrowth. The hallmark of the psychotic miasm is excess, whether in tissue growth, secretions, or mental, emotional tendencies. Physically, this manifests as the growth of warts, polyps, cysts, and benign tumors. There is often a thickening or hardening of tissues. Mentally, psychotic individuals may be prone to obsessive thoughts, compulsive behaviors, or excessive indulgence. 3. Chronic inflammation and stagnation. Psychosis tends to create chronic inflammation, leading to stagnation of fluids and tissues in the body. This stagnation often results in conditions like arthritis, joint swelling, and respiratory or genitourinary infections. 4. Mental and emotional characteristics. Compulsiveness. Mentally, psychotic individuals may experience compulsive thinking or behaviors. They might become obsessed with order, cleanliness, or specific routines. Secrecy and guilt. There is often an element of secrecy, guilt, or shame, especially regarding sexual matters or suppressed emotions. Suppression of emotions. Emotional suppression is common, and this repression often leads to internal conflict, anxiety, or a sense of isolation. Fear of being exposed. Psychosis can create a fear of being exposed or humiliated. There may be a need to hide physical symptoms like warts or emotional vulnerabilities. 5. Physical manifestations. Growth of tissue. The psychotic miasm manifests physically through overgrowth, warts, polyps, cysts, tumors, and thickened tissues. These growths are often painless but can cause discomfort due to their size or location. Thick, copious discharges. Psychosis is marked by excessive secretions, whether in the form of mucus, pus, or other bodily fluids. These discharges are often thick, sticky, and greenish-yellow. Chronic rheumatism and arthritis. Psychosis tends to affect the joints, leading to chronic arthritis with swollen, stiff joints that are worse in cold, damp weather. Urinary and reproductive issues. There is a tendency for genitourinary issues, including frequent urinary tract infections, prostatitis, or excessive discharge, e.g. leukorrhea in women. 6. Suppression and aggravation. The psychotic miasm often worsens with suppression of symptoms. For instance, if warts or skin eruptions are removed without addressing the underlying miasm, deeper issues like chronic arthritis, respiratory problems, or emotional disturbances may emerge. Typical affectations in the body, mind, and emotions. Mind and emotions. Compulsive thinking. Tendency towards obsessive thoughts, rituals, or behaviors. Secrecy and guilt. Feeling of shame or guilt, especially about sexual matters or hidden emotions. Emotional repression. Suppressed emotions that lead to anxiety or internal conflict. Fear of exposure. A fear of humiliation or exposure, both physically and emotionally. Indulgence and excess. Excessive indulgence in food, drink, or other activities, often as a form of compensation for emotional distress. Skin and growths. Warts, moles, and polyps. Characteristic overgrowth of skin tissues, often in the form of warts, moles, or polyps. These growths are typically painless but can cause discomfort due to their size. Thickened skin and nails. thickening of the skin and nails, often leading to hard, brittle nails and calloused skin. Excessive sweating. Psychosis is also associated with copious sweating, often with a foul odour. Joints and rheumatism. Chronic arthritis. Swelling, stiffness and pain in the joints, especially in cold, damp conditions. The pain is often worse in the morning and improves with movement. Inflammation of tendons and ligaments. Tendinitis and inflammation of the ligaments can also be common in psychotic individuals. Respiratory system. Chronic respiratory infections. Psychosis can predispose individuals to chronic sinusitis, bronchitis and other respiratory infections marked by thick, sticky mucus. Asthma and bronchial issues. There may be a tendency for chronic respiratory issues such as asthma or bronchial infections. Genitourinary system. Frequent urinary tract infections, recurrent infections of the urinary tract, bladder or prostate, excessive discharges, leukorrhea in women or excessive seminal discharges in men. These discharges are often thick, greenish and sticky. Digestive system. Indigestion and bloating. Chronic indigestion, bloating, and a tendency to overeat or indulge in rich, fatty foods. Constipation. Chronic constipation, often with a feeling of heaviness in the abdomen. Summary. Psychosis in homeopathy is characterized by excessive growth, chronic inflammation, and overproduction, affecting both the physical body and the mind. Individuals with the psychotic miasm tend to suffer from conditions of overgrowth, such as warts, polyps, and cysts, as well as chronic inflammatory conditions like arthritis and recurrent infections. On the emotional level, there is often secrecy, guilt, and compulsiveness, with a fear of exposure or humiliation. Psychosis manifests as both physical and emotional excess, with a tendency towards stagnation and chronicity.